Welcome to the Golden Hour, the podcast community where moms and moms-to-be hear stories from other mothers and top experts in the pregnancy and postpartum care field. You can visit goldenhour.fm for more information, resources, and all other episodes. You can also find us at goldenhour.fm on Instagram for comments and questions. All right. Welcome, everyone. Welcome to today's episode of The Golden Hour. I'm your host, Dr. O, and I'm joined by my dear friend and colleague, Kassie. Kassandra, or Kassie as I like to call her, Donnels, is originally from Sacramento, California. She attended the University of Pennsylvania for an undergraduate degree where she studied nursing science. After graduation, she worked in gynecologic oncology, gynecologic surgery, and high-risk obstetrics as a nurse in Philadelphia. This is why I said, I feel like you know more than me. You essentially just did a residency in your nursing experience. And then after a couple of years of nursing, she returned to UPenn for graduate school where she studied nurse midwifery and women's health. After graduating from midwifery school, she came back to her home state of California. Yay, that's how we know each other. Yay. And has been practicing as a nurse midwife for the past 4.5 years. And she now resides in San Francisco with her husband, her dog, 2 cats. And you also have a couple other animals you didn't list. Don't you have more?
That's it. I did have a snake, but I recently rehomed the snake.
That's who I was remembering. The snake.
Yeah, I did have a snake, and at one point I had like a 20-gallon aquarium, but we've limited the countertop items.
And the reason why you're paring things down is because you're now 24 weeks pregnant. So you had to make room for your upcoming arrival of your baby, which is super exciting. Yeah. So welcome, Kassie.
Thank you for having me. I'm great. Yeah. Excited to be here. Excited to just chat, just like we do in the Call Network.
Yeah, exactly. I was going to say, this is literally a modified version of what you and I do like almost weekly when we're on call together, except like your beautiful, luscious plants aren't in the call room. But I wish we had a stronger plant game in the call room. It'd probably make the space more inviting and more warm.
I don't know how the plants would do without the sunlight, but
without the natural light. I know. That's also the problem with a call room is that it doesn't get natural light. So anyway, that's besides the point. That's not what we're talking about here today. As I'm sure you know, with both of us working in the birth space, I feel like I love our job. We work really, really hard. We spend a lot of time with birthing people and their support people. And so much of this podcast project came from, honestly, my frustrations with what we deal with, recognizing that maybe we're not doing enough, maybe we don't know enough, maybe we're not supporting our patients enough. And so in that frustration, I recognize that I know a lot of smart, badass women, yourself included, who have a lot of information that they can give their patients and a lot of expertise, whether it's from your midwifery experience, let alone your lactation experience. And so we're here to kind of hone in on all the information that you already know and access, because very selfishly, I want to know as much as you know, because I know there's a lot in there. There's so much in there. It's true, though. It's true, girl. You're one of the most humble people I know, but you're my sweet little baby Jesus genius. You're a little genius.
I was going to say, I don't know. That's a little bit of it too high of praise, probably. But
it's how I feel. That's just how I feel. Yeah. But tell me, what made you even decide to go into midwifery in the first place? I mean, as well as I know you, I don't think I've actually ever asked you that question.
Yeah, I went to nursing school, which initially I went because I broke my arm in high school and I had to have surgery and go to the doctor like once a week. It was a whole thing. And I was like, you know what? The nurses are pretty cool and like really helped with my anxiety. I was so anxious. I was like, I'm definitely going to be one of those people that goes under anesthesia and like never wakes up. I don't know. I was just like a total mess. And the nurses were like very sweet. That was kind of my first exposure to the medical field. And so I was thinking through, I was in physical therapy 3 times a week for 6 months for my arm. It was like a really bad injury. And so I started thinking like, maybe I want to be a physical therapist or a nurse or a doctor. And I ended up sort of settling on nursing because I felt like there was a lot of FaceTime with patients and like they were really the ones that like comforted me. Like I loved my doctor and my physical therapist, but I don't know, I just felt like this emotional like connection with the nurses that I worked with. And so then I went to nursing school. I thought I would like pediatrics and I went and I absolutely hated it. I like could never be a pediatric nurse. Shout out to all of the pediatric nurses out there because I could not do it. But on my labor and delivery rotation, I had the opportunity to see, I think like 3 births and like a couple C-sections. It wasn't anything crazy, but I saw this one birth that was attended by a midwife, and the person that was like laboring was having this like beautiful unmedicated birth. It was one of those births where you walk in and you just immediately feel like calm in the room. You know, it was like dimly lit and had all this aromatherapy. And she was just like so strong. And it just felt like very, I don't know, it felt very empowering to see somebody kind of take a hold of their health like that. And so I was like, oh, you know, like that's kind of a cool opportunity. You know, one of the things with nursing is you can be a nurse, you can be a nurse practitioner, you can go on and do all of these different things. And so when I saw the midwives kind of doing their job, I was like, that could be something cool that I might want to do down the road. And then the more and more that I learned about women's health and midwifery, the more and more I was excited about it. And then when I worked as an oncology nurse after graduation from nursing school, there were so many people that had like cervical cancer that was really advanced because they were so afraid to go to providers. It was a lot of like low income, like primarily like Black women from West Philadelphia that felt like they weren't accepted or they were judged when they went to the gynecologist. And it was a lot of things that could have been prevented. You know, these were like 30-year-old women with multiple kids at home. And it was like heartbreaking. And so I think I saw midwifery as an opportunity to kind of combine this sort of like, I don't know, you get like this touchy-feely sort of emotional vibe with births that really kind of speaks to me. But I also think women's health is this really like vulnerable place. Like nobody wants to go get a pap smear, but it's very important. And I think you can really empower people to sort of take control over their bodies and over their health. And so, you know, even though I do love birth work and like the actual birth portion of our job, I also really like the gynecologic portion too, talking to like teenagers about the importance of, you know, like cervical cancer prevention and things like that, which I think really truly comes from my time working as an oncology nurse. So I don't know, long story short, it was like a few different things, but it was just really everything kind of pointed towards midwifery. And on top of it, floor nurses, I have a lot of respect for because it is a physically exhausting job. And I don't know if I could have done that for like 10 years. It's just exhausting emotionally and physically in a way that I have a lot of respect for the like career nurses that have been there for like 30 years, you know?
Exactly. I was going to say, I feel like floor nurses are like the workhorses of any good unit. So yes, applaud to them, but also applaud to you in terms of recognizing like what your niche is in terms of healthcare. It's kind of funny. I too thought I was going to be a pediatrician. Like I thought I was going to go into pediatrics as well. At some point, either very end of college or early med school, I can't remember exactly when, I started to be exposed enough to women's health and also similarly got frustrated about like health disparities related to women's health, recognized like, oh, no, this is the touch point. Like this is where I need to be. That there's something very vulnerable about women's health, but also in the right scenario can be really empowering and change an outcome for a patient, whether it's, you know, their outcome related to cervical cancer or their pregnancy related outcomes. And that can affect, you know, neonatal outcomes as well. So
totally
glad to hear we're kindred spirits in that way too. And how, like, you know, I've known you for like a good part of the start of your midwifery career. How would you say these past couple of years has it reached your expectations in terms of like helping patients the way that you were wishing? Have there been some unexpected challenges or things that you found yourself kind of frustrated with in terms of the system?
Yeah, I mean, I think it's a bit of a mixed bag. I started my career as a midwife in the beginning of May of 2020. So it was a pretty chaotic time to be starting a new career in a new state. Like the laws are different state to state with how advanced practice providers, like midwives, nurse practitioners, physician's assistants, like how you can practice. And like the culture around birth is super different geographically too. And so I think the combo of adjusting to that and adjusting to the pandemic was really challenging. I mean, I've worked at the same hospital for my entire time as a midwife, and like a year and a half in, there were times when people would see me without a mask, like drinking water or eating, and they'd be like, I had no idea that's what you looked like. I spent like so many hours with these people. So I think that created like a little bit more, I don't know, of like separation with other people and like with colleagues in the early parts of the pandemic, because people didn't want to be in enclosed spaces together. You know, it was a weird time to start a career. So I did find that challenging, but I think overall it's been really great. I mean, I think coming from the East Coast where things are a little bit less flexible with birth, it's been really nice to come out to California where things are more flexible with like labor and like letting people really labor and progress in a way that feels more true to kind of the midwifery spirit rather than having these like hard cutoffs for care. For like, oh, you've been pushing for 3 hours. We have to do a C-section or a vacuum now, even if you'd be like 20 minutes away from birth if you just kept pushing, stuff like that. So I think overall it's been good. I mean, I've really loved like working outpatient. I did not do at all. So like being in the office, seeing people for gynecologic care or for their prenatal care, I didn't do for the first year of my career. I had a slightly different job. And it is always really lovely, especially I love seeing adolescents, and where our clinic is like a mile off of Berkeley's campus. And the number of times I see like 21-year-olds where it's their first pap smear and they're like, I was so afraid of that pap smear. I was so nervous to come in here, and that really wasn't bad. Thank you so much. And I'm like, yay. Like, that's like why I got into this. Or the number of people during their births and deliveries where they're like, all I've seen online is these traumatic birth experiences. And this was just like really lovely and straightforward. Or when people have a really traumatic first birth and you get to like be a part of their kind of healing second birth, where it's, more of in line with what they wanted the first time. I think those moments really jump out to me and like warm my heart. But then there are also times where you're like so stretched thin because of the way that the medical system is built, where you're seeing people and you have a 20-minute appointment and they haven't been seen in 5 years, and you're trying to address all of these concerns because who knows when they're going to come back, for care, or you're seeing them in the beginning of their pregnancy, and you feel like you're in this sort of tough place between providing really excellent care and running really behind to where people are going to be upset with you or you're going to waste people's time. I think that part has been particularly difficult, just having to try to function in what is healthcare in the United States.
No, I mean, you said so many things that I want to reflect on. One, just the joy of work. I think that like the diversity of patients we get the honor of caring for, whether it's based on their age or what they need, it keeps our jobs so fun. Like it's like to go from like one appointment where, I'm talking to a teen about contraception for the first time. And then like the next patient over is someone in their 60s dealing with menopause. Like it's what keeps your brain like bubbling and makes it feel like it's so engaging.
Yeah.
But in that, also just acknowledging, that our healthcare system is not a perfect one. I think, again, a lot of my frustrations I'm trying to turn positively into something productive is just recognizing there are limitations in terms of, I think we give really good prenatal care, right? I think it's set that I think each patient has 7 to 10 sessions of prenatal care depending on insurance coverage. I personally don't feel like 2 postpartum visits is nearly enough. I think that postpartum is a longer trajectory that definitely needs and deserves more support. And so I think that recognizing the limitations of healthcare gives us opportunities to hopefully find solutions within those limitations or beyond those limitations.
Yeah,
today, absolutely. You are my solution because in addition to being a midwife, at some point, and all these other amazing things that you did, at some point you did some like special training as a lactation consultant. Can you tell us more about that?
Yeah, I had the opportunity. So I'm a certified breastfeeding counselor. It took less hours than becoming a lactation consultant, but it was an extra thing that I could help people with at work, just having extra background information. In addition to that, I had the opportunity to take this undergraduate course at Penn with, her name's Diane Spatz, but she's one of the world's leading like breastfeeding researchers, essentially. She works at the Children's Hospital of Philadelphia, primarily with
very cool
preemies, like micro preemies especially, and kind of has studied like breastfeeding and pumping in relation to like NICU babies mostly. But it was a semester long class that met for 3 hours a week. So I got a really cool opportunity to work with somebody really advanced in the field with like a 6-person seminar. So that kind of like started that sort of passion of mine. And then when I became a nurse, I had an opportunity to do like additional trainings to where I could, add it onto the resume and also just have more information.
Degrees on degrees.
Right, exactly. It wasn't like a crazy big thing, but it was really great. We're at work. The floor that I worked on as a nurse had high-risk postpartum patients, so people who needed to be on like telemetry for like cardiac issues or severe preeclampsia, different health conditions where they were definitely more at risk for having problems with their breastfeeding, or people who had babies in the NICU we would have down on our floor, so that way they wouldn't hear like screaming babies and stuff on the regular postpartum floor while their baby was sick upstairs. So it was really great to kind of take that experience and apply it to work as a nurse. And then now as a midwife, it's really great when I'm seeing people postpartum and I feel like I have more background information to be able to jump in and help people with breastfeeding. Yeah.
I would acknowledge, and maybe other training programs are different, but I would acknowledge that definitely, at least in my residency program, well prepared in so many ways, but I feel like the lactation portion was so minimal. Like I think we had one talk that was given by one of our wonderful midwives, and like that was it. And so I find that, there's so much, being in medicine means that you're a lifelong learner, it's what makes it so engaging, but it also makes it humbling, where I feel like a personal black box for me definitely is the lactation space. I always joke it's because I've never lactated myself. I feel like a lot of us doctors, at least, we learned once we became mothers, because then we had to we had to really learn.
Right.
But for me, it's recognizing that, obviously now practicing for many years since, I've learned enough, but I definitely think that the support can be better.
Yeah.
Whether that support is coming from me or our system. And so I love that you took that extra effort to gain that additional training. Can you explain what's the difference between a breastfeeding coach and a lactation consultant? Is it strictly just like hours and credentialing?
Yeah, it's hours and credentialing. Like it's a different kind of the classwork, the coursework that you have to do is more like it takes longer to become a lactation consultant just in your education. And then the credentialing and kind of license upkeep is a little bit different as well. As a breastfeeding counselor, you couldn't really work as like a lactation consultant as like your full-time job in the hospital. I think you would need more experience than that, but it's something that is almost like offered as just like a supplemental education for like pre-existing healthcare providers. So like a doctor could become a certified breastfeeding counselor. I think truly just to fill in sort of that gap in education that I think exists for a lot of doctors and for nurses. Like we had even like going to Penn, where we had a faculty member who was really big in the breastfeeding world. We still just got like 1 3-hour long lecture on breastfeeding, and that was it, unless you took other classes. So I think it was really just supplemental, essentially.
Yeah. No, I'm glad that you took advantage of it. And now I'm like hearing you, I'm like, oh, maybe I can sign up and do this too.
Yeah.
Do you have any thoughts, like even hearing you, like I honestly I assumed it was maybe something more consistent with like maybe OBGYN residency programs, or maybe unique to my OBGYN residency program. But even hearing you, like even your nursing program, it still was like a brief course. Do you have any thoughts or reflections why you think that lactation is like inadequately taught in our training programs?
Yeah, I mean, I think part of it is like it's inadequately taught. So you have to kind of bring in an outside person to teach, you know what I mean? Like I think in nursing school, there are lactation consultants that could come in and speak more to it. But I don't think just like the nursing professor of like labor and delivery and OBGYN, or like OBGYNs teaching at a residency program, like I don't think that there's enough knowledge in those people to be able to like pass down. I think it was something that was less prioritized previously, like 30 years ago. My mom had me and was like, I tried breastfeeding for 3 days and it was hard. So I just switched to formula, because I think that there wasn't as much knowledge about all of the benefits of breastfeeding.
Yeah.
Obviously, breastfeeding doesn't work for everybody. I don't know if even with the amount of information that my mom had, if she had all the information we have now, I don't know if she would have tried harder to breastfeed. Like I have no way of knowing that, but I certainly think it would have made a difference. And also I think there are more resources today too, but I think it's like a changing field, and a changing, like there are a lot of attitudes towards breastfeeding and towards just infant feeding in general.
Yeah.
But I honestly don't know. I mean, that's something that we talked a lot about in my breastfeeding class during undergrad, was kind of lack of adequate training for healthcare professionals that are going into women's health. Yeah. And I mean, as a nurse, we had the opportunity. I worked at a baby-friendly hospital, which I know the hospital we work at is also trying to get their baby-friendly credentialing and stuff. But as a result of being a baby-friendly hospital, there was extra training that the nurses had to do specifically in order for the hospital to maintain that credentialing. So we did have the opportunity to have lactation consultants come in. And I think it was like, I don't know, maybe like 6 hours of training. It wasn't anything crazy, but it was still better than nothing.
Still better than nothing.
Yeah. And I think combined with the hands-on experience, like I think that that's also something that is more difficult as, like a doctor. You have so much stuff on your plate. You're seeing patients on labor and delivery. You have like a list of like 20 people you have to take care of in a day when you're in the hospital, versus the nurses have 4 couplets usually, where it's like the parent and the baby. So you have just like a lot more time to spend in sort of trial and error, seeing people breastfeed, assisting them with breastfeeding, watching the lactation consultant help people with breastfeeding. Like we just don't have the luxury of the time as like providers rather than nurses, I think.
Yeah, no, it's true. You're making me feel better. You're helping me with my guilt a little bit. But still, I do think that like our goal is to be like any source of information for patients, or at least can get them connected to the specialists that we know. You, to me, are unique that yet, even though you're not a lactation consultant, even with your breastfeeding counseling degree, you still have information that patients probably find so helpful. How have you integrated that into your midwifery career? What does that look like for you?
Yeah, I think it helps with just assessing how breastfeeding is going when you are seeing people for those 2 postpartum visits, or you're seeing people in the hospital immediately postpartum. I think with anything, the more that you know about a subject, the more you can ask questions to kind of get to the bottom of what's going on. Like how many times do you see somebody in the office and you're like, do you have any medical conditions? And they're like, no. And then they have diabetes and high blood pressure. And like, now you know to ask those things.
Exactly.
So I think with breastfeeding, like going in and being able to like observe the latch and be able to like actually look at it with having some background information on like things to look for, to like assess for like a proper latch or kind of one that might cause some problems down the road. Like, I think I'm not very hesitant to like jump in and make adjustments or help give pointers when they're trying to get the baby on the breast while you're like in there talking to them, I don't know. It's definitely like a challenge. I think I'm not using the like my lactation knowledge as much as I did as a nurse, just because, again, like my time with people is a little bit more limited. But in prenatal care, I think also just talking about breastfeeding, like when people have questions about breastfeeding, I think I feel more equipped to answer them, because I do think, while sometimes people meet with lactation consultants prior to having their baby, or they take a lactation class prior to having their baby, the resources are a little bit more limited, I think.
Yeah. What are some of the common questions that patients ask you prenatally about breastfeeding?
I get asked a lot about when to introduce bottles and pumping, especially. I think people are pretty excited about the opportunity to pump maybe like once a day, to have somebody give a bottle like once, to be able to allow somebody to have like 3 hours more sleep uninterrupted or something. I get asked a lot of questions about that. I do get asked, the one thing I don't feel as equipped about is I get asked a lot about like if they are going to use formula, like what formula to use and things like that. I usually will refer them to the pediatricians for that one, because again, like I feel like my focus was breastfeeding, not so much the formula feeding. And then I also think like types of pump, like I think the things that people are getting to like prepare for breastfeeding, or like honestly including things in like when we're talking about things to bring for the hospital that aren't like necessities necessarily, right? Like people will bring in a speaker to have music while they're pushing or laboring or whatever else. Like I think different breastfeeding supplies to bring to the hospital is something that we've talked about, like bringing in like a nursing pillow to help with extra support, make it a little bit easier to practice feeding in a way that you're going to actually be feeding when you go home, or different just like self-care things to help with like cracked nipples or bleeding nipples, things like that.
Because I'm learning from you right now, Kassie. So I want specifics. I'm like, what are the things that you teach them? But go ahead.
No, I was going to say like one of my biggest pieces of advice that I will give people postpartum while they are breastfeeding, or when they're buying stuff as like a pregnant person, is to not immediately invest so much in getting like a bunch of different like nipple balms and creams, because in studies it's been shown that like expressing a little bit of breast milk or colostrum and using that as like the nipple balm or nipple cream actually has been shown to be more effective than using like nipple balms. And it's free.
It's free. It's free 99.
Yeah, exactly. Maybe in the first couple of days when you're not making a ton of colostrum, they could be helpful, but it's great because it works again just as well as the creams. And then it also has this added property of kind of the antimicrobial property that your breast milk has. So it helps prevent infection. So if you do have like a little bit of nipple breakdown, it almost works as like a little like antibiotic or something, preventing things from getting infected or really angry. So yeah, that's one of my big tips. Another thing that I like to tell people, I have a couple of pet peeves in the breastfeeding space. One of them is that nipple shields are really overused. Nipple shields have not been shown. Nipple shields are like little silicone guys that go over your nipple, make it easier for like the baby to latch on to the breast. I find a lot of people will get them for nipple pain, which has not been, like nipple shields have not been shown to be at all helpful for nipple pain or nipple breakdown. It is my biggest pet peeve when people get started on those from the guidance of like usually lactation consultants. It was a peeve of my like professor during undergrad. So I think I have inherited that from her.
Yeah.
But
no,
like,
I love it. Let's rock it.
Absolutely zero evidence to support that. And then it becomes this whole hassle to where like one of the perks of breastfeeding is supposed to be that once you get it down, you can do it anywhere, right? You don't have to deal with like storage and cleaning of these parts for bottles or for pumps. And when you introduce a nipple shield, that changes. You then have this thing that you have to bring around with you everywhere. You have to clean it. You have to make sure you're cleaning it properly. And then the babies can become dependent on it to where then having to like wean off the nipple shield. I don't know if you ever hear people talk about this, but I feel like I hear complaints all the time from people of like, I really want to be done with the nipple shield, but my baby like will not feed unless I have the nipple shield
without it.
You know?
Yeah.
That's a big pet peeve too. So I sometimes will mention that postpartum when people are like talking about things that they can do to help with nipple pain. I typically do not recommend that unless the latch is really shallow. Sometimes it can help the baby get like a deeper latch. And so if they've done everything else to try to get the latch to be a little bit better and it's still not helping, then in that case, I think it's reasonable. But for nipple pain alone or like nipple soreness, just from like using them a lot in the first few days, I'm always like, do not go down the nipple shield route. Like
step away from the shield. Step away from the shield.
Like it might seem like a good fix now, but like 3 weeks from now, you might like be frustrated by it, you know?
Yeah. Yeah. But you're right. I mean, like I can go through my head, like all the most common like breastfeeding concerns I hear within those, first month postpartum. And a really common one is the nipple pain, the breast pain, the soreness. I usually try to acknowledge like, it's your breasts and have not been used in that way repeatedly ever. And so it's just like kind of the way that we form a callus when you like do a lot of like something that requires like a hand skill where eventually it doesn't hurt anymore. Not that your nipples become callous, but the nerves just become like more desensitized.
Yeah.
So that's part of the counseling that I do.
Absolutely.
But is there anything else besides do not go to the nipple shield and then potentially like colostrum and breast milk just to help with the cracked nipple? Anything else that you've found to be soothing, either from your research from your prior professor or what you know from your training?
Yeah, I really like, there are these things called silverettes that are little, the size of maybe like a silver dollar or something that are sort of like nipple shaped. Yeah, you can put in a little bit of like hand expressed breast milk in them and kind of like slap those guys on. And that can be really nice and kind of cooling. And also silver, it has antimicrobial properties too. So it's also good for like infection prevention. Those can be really great, as well as just like ice packs and stuff can help in moderation. You don't want to use ice packs all the time, but a little bit of ice packs are really helpful. Or sometimes I've even had people like fill up their sink in their bathroom with warm water and just kind of lean over and like rest in it for a couple minutes. Exactly. Yeah. That can be really good too. But I think you're right that a lot of it is just kind of getting through the first couple weeks and making sure that you are being seen by somebody, like maybe going and seeing a lactation consultant once or twice and making sure that there isn't something wrong that's making the pain worse than it should be. Like soreness and stuff is normal, but like really sharp pain or feeling like the baby's biting is not normal.
That's something different.
Yeah, that's something different. Or if you're having like bruising on the breast, like that is something is up and needs investigation. Yeah. Yeah.
No, that's really fair. It's a delicate balance of providing reassurance, but also providing return precautions, right? Also saying like, hey, but XYZ, that warrants seeing a specialist or seeing your OB provider.
Totally.
What are other common challenges of breastfeeding that you feel like come up a lot that you seem to address besides, breast or nipple pain? What are other things that...
I think a really common one, especially with the amount of anxiety that exists in our generation.
Yes.
I think pretty universally, I think that there's a lot of anxiety about how do I know that my baby is getting enough, right? Because with formula feeding or with exclusive pumping, you can see exactly how much your baby is getting and be able to say like, okay, I know that my baby got like 2 ounces, so I know that they're good. Versus breastfeeding, you're kind of just doing it and you're like, okay, well, I guess that's fine,
Yeah.
Like I've had people that will start pumping or start formula feeding specifically to be able to have like measurable input for like how much they're giving their baby, to be able to have kind of that feedback and reassurance of like, okay, everything's fine. I usually it's hard with that one because you can get scales where you measure your baby before the feeding and after the feeding. That's like what the lactation consultants will do to like check the milk transfer. I was always taught not to like recommend those or use those routinely because they can sometimes cause more anxiety because you sort of grow like accustomed to having that. And so if you're out of the house or you're like on vacation, you're not going to bring your baby scale with you, you know?
Probably not.
And especially in those first couple of weeks when they're like under their birth weight and gaining it back. I don't know. It's just too much in somebody that already is like tired and anxious and adjusting to a lot of new things. So I always tell people to keep an eye out for sort of those more subjective signs that the baby is getting what they need. So kind of peeing and pooping adequately, looking satisfied after the meals. You know, like if you feed them and they're like milk drunk and they're peeing and pooping a bunch, then you can feel reassured that you're doing all of the right things, you know?
Yeah.
And that your milk supply is good. And if you're going to your pediatrician, or like in some cases, like your midwife, if you're seeing somebody out of hospital and the baby is like gaining weight appropriately, then that's another good indicator that your body is doing all of the right things. But it is hard. I think we're used to being able to like, oh, you have a question about something? Let me just like real quick Google it and get the feedback within like 0.2 seconds. With this, it's a little bit more of like, you have to trust your body. I think with a lot of stuff with birth and with your health in general, it's a lot of trusting your body. And I think we're kind of not used to doing that. You know?
Yeah. Preach, sister. Preach. Yeah. I had one of our mutually good friends and colleagues, Martina, on this podcast probably at least like a month ago now. But part of what we talked about is, I think in our field, it is reestablishing like the trust in one's body again, that the whole field of like, there's modern obstetrics, but there's just birth has existed even before modern obstetrics. It went from this place of like very paternalistic, like very medicalized, to now we're kind of hopefully swinging somewhere more in the middle, where I as an obstetrician, as a doctor, definitely recognize there are times where I'm for sure needed. I am grateful for my skill set when it is really needed, but also somewhere in the middle of recognizing that the human body, for those who are able to carry pregnancies, it's also meant for this, and trusting that, and that same human body releases amazing hormones as soon as the baby's out called oxytocin to like help your body produce breast milk. Like that same body can do it all.
Totally.
So I'd like to take a moment to tell you this is my passion project based on years of experience as an OB/GYN doctor. I aim to empower moms and moms-to-be and those in the pregnancy and postpartum care space. If you appreciate what I do, please take a moment to like, subscribe, and share with your friends so it can reach more people like you. You can visit goldenhour.fm for more information, resources, and all other episodes. If you have any requests, suggestions, or questions for future episodes, please email me at hello@goldenhour.fm or leave us a comment at goldenhour.fm on Instagram. We have a lot of patients who come to that first appointment or appointments and after with so much anxiety. I think one of the culprits of that is social media. But I was curious if you have thoughts about, why you think patients enter their appointments or the labor and delivery unit with so much anxiety, so much fear.
I think you're totally spot on that it's social media related. I think generally if something happens close to you and you know of somebody who's like the 1%, your brain jumps to that place pretty quickly, right? Like when I was an oncology nurse, I saw like 25-year-olds with ovarian cancer where I would be like, oh my gosh, I have a twang in my side. I must have ovarian cancer too. You know what I mean? Where like, even though that's not very logical, like the risk of that happening is so incredibly low. If that's what you're exposed to, then that's what you're going to think of. And I think on TikTok and I don't know, just being in it's been really eye-opening for me being a pregnant person, having been a provider, just seeing like some of the stuff on these like Facebook groups and stuff. You see people post about things that happen to them because they're looking for support that are like really rare and challenging. But then I think that sort of feeds into anxiety for other people, which makes it sort of this negative feedback loop where people are way less likely to post about like their really great experience. They're a lot more likely to post about something really terrible that happened to them. And I think when you are on social media, your breadth of like exposure or like number of people that you're exposed to, which means like the number of potential complications you could be exposed to, like that, the chances of seeing crazy stuff is way higher. Mm-hmm. Like, I think for me as a healthcare provider, it's honestly been like an interesting journey for me with anxiety. I don't skew towards being a super anxious person most of the time. There are like certain things that sort of like trigger anxiety for me, but I did not expect myself to be like a very anxious pregnant person. And for the most part, I haven't been, but I think like those first couple appointments, I came in with so much anxiety. And I think part of it is it's like at our job, we see a really high volume of people, you know, where even if I wasn't seeking out stuff on social media, like we see 20 patients a day, you know, so we're going to run into things that are really terrible, like complication wise, or just seeing people with miscarriages. Like when I was 5 weeks, I had one of my patients who I had cared for her first pregnancy. She miscarried like when she was a couple of days ahead of me and was like messaging me about it, you know? And so I think like that was really eye opening for me, where it's like, oh yeah, if you're seeing this, whether it's social media or at work or otherwise, your brain is going to like jump there immediately, you know? Like for me, I found that's when my anxiety has been triggered throughout pregnancy, is when I've had something happen at work that has been bad, like a anatomy scan that came back abnormal or something, you know, when I was like 18 weeks, where it's like, okay, that's like 2 weeks ahead of me. Like I could theoretically also have that thing wrong. I haven't like disproved that being present in my own pregnancy, you know? So I think I like have a little bit more empathy towards the anxiety now than I did. Not that I wasn't already empathetic towards it, but now I'm like, oh yeah, I get it.
I'm in it.
Know?
I am in it.
And I think social media sort of gives people similar exposures to like what we're exposed to, but it doesn't include the background information that we have from like many years of education and experience of like, okay, this happened to somebody. Statistically, the chances are so low. Or like, oh, this person had a bunch of risk factors for it. You know, like, yes, there was a cardiac anomaly in the baby, but they had multiple family members with cardiac anomalies where they were at a higher risk of it than like I would be, you know? So I think you're kind of like blindly seeing these really scary things. And then it's totally normal for kind of the worst case scenario to jump into your brain. I don't really know what the solution is, because I do think it can be like a good place for information and support, but you're just hearing horror stories.
I think, like you said, I think social media has its place in that it creates community, and it does create like access to information that some patients maybe otherwise wouldn't get to see or learn from. But you're also right where it's not vetted. Like I always say, my arch nemesis are Dr. Google and Nurse TikTok, because the algorithm is smart. Whatever AI bot that created the algorithm just knows like what will like get, you know, multiple clicks and on and on and on. But when you don't have experience to process information and understand that that's not exactly how every pregnancy or labor is going to go, it can be overwhelming.
Totally.
I also have to acknowledge that I have my own anxiety. Like you said, what we see at work, right? Like people often ask, like, oh, when are you going to start your family? I'm still undecided. And some of my indecision comes from the fact that I'm working through my own anxiety of what I know related to maternal Black birth outcomes. And so it's just acknowledging that there are things that we see that are real, really real, and how those things affect us is so deeply personal. And I think my goal in conversations like this with you, and why I'm so grateful for our friendship and let alone our work wifey-ship, is that we're acknowledging the anxiety and not dismissing it, but also hopefully being like a source of information that can allay that as best as we can.
I think you hit the nail on the head that I think acknowledging the anxiety is important, but I think also having kind of I always joke around with my like therapist that there's like this kind of emotional side of your brain that jumps to these scary places, and like the logical side that can sort of like try to reason with the emotional side of like, okay, I'm feeling all of these things and that's fine, but also let's like think about it and kind of try to process why I'm feeling that way. And like, I don't know, any kind of anxiety is totally valid, but I think trying to think about whether it's like rational anxiety, like I think for you, like I think that that's totally a rational fear and anxiety of like Black women do have like worse outcomes in maternity care. Like I think that that's really real, and I imagine really hard to work through because there's like evidence, like strong evidence to back that up, versus for me, if I'm just like letting my mind wander about like the things that don't make any sense, I can be like, oh, that's just my silly like other half of my brain thinking, you know? It's hard when it's rooted in reality versus just like anxiety that cycles on itself.
Well, look, I just got a free therapy session with Kassie Donnels, breastfeeding coach, nurse midwife, as well as my personal therapist. No, I really do appreciate that reflection. Going back to our original topic of, the umbrella that is breastfeeding, something that I also feel like comes up a lot is like breast milk supply. I think there's it's very common that patients come in concerned that they don't have adequate supply, sometimes issues with oversupply, and really that, especially for patients who have low breast milk supply, this like you get that sense of desperation of like how to increase the breast milk supply or what to do. What experience do you have with that topic?
Yeah, I mean, it's hard. I think that milk supply is a really challenging thing to tackle because I think there are kind of two camps of people, right? There's the people that are like worried about their milk supply, but actually everything's fine, where you kind of dig into it and you're like, well, is the baby gaining weight? Are the pediatricians concerned about it? And it's like, yes, the baby's gaining weight. The pediatricians are totally fine. And it's like, okay, well, then you can probably just like try to let that go and take that off your plate. It's like trying to not be something that is stressing you out. Other times there are like, medical issues that can increase your risk of having low milk supply, like PCOS, for example, that is really common. It's like 1 in 10 people has PCOS, or like thyroid issues. I think especially as people are starting to have kids later in life, they're more likely to have these comorbidities that can make supply issues be more prevalent. And then it's also hard because you also have people that come into it so worried about their milk supply where they start out feeding and pumping up a storm, and then they have these crazy oversupply situations where they just feel terrible. With low milk supply, I usually recommend, like, if the baby is losing weight and the pediatricians are concerned, like if we've sort of ruled out just sort of anxiety for anxiety's sake versus like an actual milk supply issue, I think seeing a lactation consultant and having somebody you can see really regularly is helpful. And also doing like extra pumping sessions. It's all about like, how much do you want this? I think, I think breastfeeding can really take a lot of time and energy rather than with formula. You can grab the pre-made formula or like mix up some formula and it's just done, rather than breastfeeding. Like it can be low maintenance, but also can require like where you spend 40 minutes breastfeeding and then another 20 minutes pumping. And then an hour later, you start the cycle again. I think it's a hard thing to tackle. One thing that I usually tell people, because you'll hear like, make sure you're feeding every 3 hours, or for people that are like exclusively pumping, or for babies that are in the NICU, like pump every 3 hours. But I was always taught 8 or more in 24 is the phrase that I use. Where
eight or more in 24. Feeding. Okay, explain that.
Yeah. So like during the daytime, this more applies if you're like exclusively pumping or like relying on your pump pretty heavily, but pumping kind of every 2 hours during the daytime, where then you can go 2 4-hour stretches overnight, which I think makes a big difference, where you can stretch it out 1 more hour. Another thing I think that is really important, especially, again, I think like a lot of my knowledge is at its roots based in like more complicated situations where babies are maybe not as present with the parents, whether they like have to go away to the NICU for 6 hours or be in the NICU for weeks. But the breastfeeding that you do in the first 2 weeks impacts your milk supply throughout the entirety of your breastfeeding journey. So if you are kind of like slacking, like I've seen people in postpartum where they just like let their baby sleep overnight for like 8 or 10 hours because the babies are tired and, not wanting to eat, that can really impact your supply later. Like I think catching it early or doing the first feeding within the first hour of life, whether that's feeding or pumping, like ideally you're able to just feed then and there because your baby is with you and you're doing the hours, the golden hour, as they say, skin to skin. But I think we as a healthcare team have some work to do in like education in that regard, because I think people don't always prioritize that in the first few days. And I think if you're okay with your milk supply potentially not being great and needing to supplement with formula, like if that's kind of where your priorities lie, that's obviously totally valid and fine. But I think for somebody who really wants to breastfeed and it's a really important thing to them, trying to make sure they're feeding like every 2 to 3 hours in the beginning and feeding within that first hour or pumping within that first hour if their baby is in the NICU, it's really important. yeah, again, I just don't think we talk about it enough. And I don't think a lot of people realize that to be able to talk about it to their patients.
Yeah. And that's why we're talking right now. But no, seriously, exactly. I mean, truthfully, I always feel humbled because every day, as I said earlier, being in medicine, I think we're in general lifelong learners, but I get to learn from my own colleagues. And I'm hoping that whoever has the opportunity of tuning in right now, patients alike are learning from you right now. I think you're a wealth of knowledge.
Oh, thank you.
I think something else that I thought about as you were discussing, I think we go back to maybe I'm naturally inclined to go back to the emotions of things, because I do think that part of honoring our patients and sitting in that space with them, with the highs and lows, there is a lot of emotions around, postpartum in terms of like the new demands on oneself. So even hearing you say, oh yeah, if you're exclusively pump every 2 hours during the day so that you can hopefully get longer stretches at night. But there is that experience. And I'm thinking about a girlfriend who just had a baby 3 weeks ago. I just visited her this weekend. She's like, honestly, like even when he's sleeping, I'm doing something related to my breast, whether I'm pumping or cleaning my breast like supplies. And like by the time we put him down, change his diaper, and like he's actually asleep, I honestly really only have an hour until he's up again, like that feeling of constantly on the clock. I wonder, we talked about anxiety related to outcomes, but I also think about the patients who've come to see me, and I'm sure have come to see you, who have some degree of postpartum depression related to just like how much pressure they put on themselves breastfeeding, and like that delicate balance. Because when I hear that time clock of like every 2 hours or every 3 hours, how does someone find that balance in terms of like self-care, still do what their body needs them to do for their baby?
Right. I think it's a really delicate balance, because you don't want people to feel pressured into, like, I hear from so many people that they thought breastfeeding would be easier and they really wanted to do it and they're like working so hard at it, but you can tell that it's like a huge source of stress in their life that could be contributing to like postpartum anxiety or postpartum depression, or just general like happiness in their day-to-day life and like finding joy in like this new and exciting period in their life. For me, really focusing on, it's all a give and take with breastfeeding and with just infant feeding in general. And I think giving people permission, almost not that like, I'm not in a place where I need to give people permission to like feed their baby in the way that they want to feed their baby. But I think sometimes when I ask people like, how are you feeling about your breastfeeding journey? Like, have you thought about supplementation at all, to like help with your mental well-being, like your mental health? And I think sometimes just the relief that people have of like somebody suggesting that as even an option is really striking, because I think some people feel like they have failed if they aren't, like successful. I'm doing air quotes for people that cannot see me, but like aren't successful in their breastfeeding journey. When I think kind of trying to redefine success as like finding feeding method that works the best for your family and works the best for you is the most important thing. And so whether that's doing exclusive pumping instead of breastfeeding, so you're sort of eliminating the stress from like having to deal with like the latch or like not being able to see how much milk you're producing, or whether it's doing kind of a combo of formula feeding, pumping, breastfeeding, whatever, I think trying to find that balance for what works best for you is the most important thing. And I do think, like we talked about earlier with social media, I think it's hard because, like, again, as a pregnant person, I'm getting all of these posts that I never got before, like on TikTok and things like that. And some of these people produce so much breast milk where they're like crazy oversuppliers, and it's just normalized as like, this is how much milk they're making. And I can imagine how disheartening it is if you're looking at somebody like that who's pumping like 10 ounces in one pumping session, like how that can be difficult, So I think just trying to normalize that it's okay to like make adjustments to what your overall goals were in regards to feeding. I feel like that with labor too, of like, always don't call it a birth plan. It's like birth goals or birth preferences, because things are going to change. Some people have labored before, but for a lot of people, it's their first time doing all of this. It's your first time feeding a baby. It's your first time breastfeeding. It's your first time birthing. And you have to be flexible with yourself and give yourself grace. I think it's hard because as a mom, like I always tell people, like the fact that you're so concerned about this tells me that you're already such a great mom, like you're already focusing on all of this stuff, but like you have to take care of you in order to take care of other people. I think it's just really, really hard.
No, you said it so beautifully. It's not in any patronizing way are you giving permission so much as you're just creating space for patients to like listen to what they really need. I think something that you said earlier when we were talking about, I think we were talking about pumping or something earlier, you were saying something about like, yeah, how much do you want it? Right? Like it's really up to you. It's not up to social media. It's not up to what your other girlfriends did before in their pregnancies. It's really up to that person. My favorite concept is giving yourself grace. Like I actually, when I was thinking about creating this podcast now years ago, I actually thought I was going to call it something like grace or something related to that. Because I really do think that whether it's related to like birth and like all these like insanely detailed birth plans that we get versus like the postpartum expectation is in the end, we have our preferences, but just give yourself a place of grace because there's only so much we really can control. I think that's the truth.
Yeah, I always felt that. I think like that lack of control can be really stressful, especially again, like I think with people having kids later in life, like if you're the 35 having a kid, you've had like a whole adulthood of like being not wholly in control of your life, but you've had a lot of control. And then you're just throwing in this variable of like this small human that can disrupt everything or like labor. And I think sometimes the knowing that you don't have control over the situation or you have control over like focusing on what you do have control over and sort of like letting go of all of these things that you don't have control over is important. I think that can be sort of freeing where you're like, well, I can't control this. I'm doing all the things that I can and I'm just going to have to let this other stuff go, like let these expectations go. It's easier said than done though. It's easier for me to be like, you can't control it. Just like, don't worry about it. A little bit different when you're the one doing it.
I know it's the ultimate is like sweet surrender, but surrendering to something really it takes bravery. It takes courage. It takes a lot. So that's why I have so much admiration for not only our patients, but you're on your own pregnancy journey as we speak. As you talk about things like this with me and probably replay all the conversations that you've had over the years with patients and clients alike, let alone what TikTok's telling you. How are you kind of approaching your own postpartum experience? Have you already started thinking about it, planning, or maybe preferencing, if you will?
It's been an interesting experience. I think I keep saying that I think this pregnancy has, for part of it, been almost like a little bit of a science experiment for me of like, it's this thing that I've been exposed to so much in like my professional life, but I haven't obviously been exposed to it in my own body or like my personal life. I don't have a lot of friends that have kids. Like this is really, I don't know. Personally, like it's been really interesting. I think in general, I'm trying to like be flexible. I think it's difficult though. My husband has been very good, even just with anxieties and earlier pregnancy, especially where he'll be like, well, what would you tell somebody if they were concerned about this? Or if they reached out to you and sent a message being like, hey, X, Y, and Z happened. And my answer would be like, it's fine. Don't worry about it. And he'd be like, okay, so like take your own advice. Like, it's fine. Don't worry about it. Going forward with birth and postpartum, it's funny that you mentioned this because we were literally just talking about this yesterday of like what our plans are going to be if we're like dying from lack of sleep, if our baby is like a really bad sleeper and like we're just super sleep deprived, like what resources can we tap into and like try to have sort of like somewhat prepared in our brains as like resources we can jump into that we don't have to think about for the first time when we're again like sleep deprived and making a lot of life adjustments. Like we were talking a little bit about like a postpartum doula or like taking shifts in the night of like, like having a period of time where like I'll do all of the things for the baby and then he'll do all the things for the baby. Like, I don't know, trying to come up with options. I think I've been really strong in just like, let's see how it feels. Let's see how our baby is because babies are really different. Same with birth. I feel like with labor, that's also kind of how I feel of like, I'm just along for the ride and we'll like see how it goes. Everybody's really different and it is what it is. And that doesn't really answer your question fully, but no, it's been a journey.
I mean, you're in it. You're literally on the journey. Like if I'm so fortunate and this podcast still exists, months from now, I'll bring you back when you're like well into postpartum, like, all right, girl, 6 months in, how was it really?
Yeah.
And I think as we've said a couple of times, it's a delicate balance, right? There are ways to kind of overly exert our wants to create a locus of control. And there's also ways to just be prepared and planned, right? That everyone knows those first 3 months are like the gnarliest of times, right? Because the baby's still figuring out their sleep cycle. So it is reasonable, if you need more sleep than most, it's reasonable to consider the options of a postpartum doula or a night nurse if that's something that you have the ability to work with. I think when my husband and I talk on and on about like kids, no kids, what are we doing? One of his biggest fears is like the lack of sleep. And I'm like, that's just how it is though. Like you're not going to get 8 hours. It's just not possible. But totally. In that, one of his own personal priorities, and I think it's so funny because I think we work on labor and delivery. Like we can function like after being up for 24 hours. Like I just can do it. I don't love it, but I can do it. And so meanwhile, he's perseverating over the sleep aspect. So I'm like, okay, well, if we ever do decide to start a family, like we will prioritize probably having, extra support at nighttime so that we both feel like we have that support that we need. And so it's understanding what you and Alex need and understanding what that looks like, or at least preparing for those options.
Totally. I think like the dynamic between you guys is very similar, where he very much needs his sleep. And everybody needs their sleep, but I think having the jobs that we have, you grow accustomed to weird sleep schedules or lack of sleep, where that's not a thing that concerns me as much as as other, potential things that could happen postpartum. So it's just funny, everybody has their own things that stress them out or that make them nervous. And I think trying to come prepared in a flexible manner is what I'm trying to do. We'll see how that plays out later. I'll let you know.
No, it's a great mantra. It's a great mantra. And I would say that of all of my guests, you're my first guest who's mid-pregnancy, which is super exciting. I've talked to a lot of moms who are, either a year or two or more postpartum. Yeah. And so I want to take advantage of the fact that you're in it. Besides sleep and the lack thereof, what are other things that you are either looking forward to, excited about, or what are the things that you're anxious about looking forward to postpartum?
Yeah, I mean, I think I'm excited about a lot of things. Like, it'll be fun to have just like this little person as a new family member and just like learning their habits and kind of their personality. We just went camping over the weekend, and when we were driving home, the baby was like kicking around, and we were talking about how weird it is that this person that's going to be in our life for hopefully the rest of our lives, is just like here with us right now. Like, it's really crazy that they're just going to be on the outside world in a few months and be doing their thing. So I'm really excited about that. The things that I'm more nervous about, I think navigating sort of family dynamics in regards to having a baby. And I think making parenting decisions that maybe wouldn't be the same as like the decisions that like our parents made as parents, and kind of having to stand up for your choices. I'm not super looking forward to that, just because I tend to not love conflict. So I think like trying to adjust to like advocate for the things that I feel like are right for my family, that maybe, my family or like my parents or like Alex's parents didn't, feel like were a thing in their family. Even just like with sleep stuff, my mom, when I saw her over the weekend, she was like, even my mom this weekend was like, what are they saying now? To sleep on the side or the stomach for the babies? And like me now, like I've been in practice as a nurse or as a midwife for like the last 9 years. And it's always been like alone on their back in the crib. And so when my mom was like, they had devices where we would prop you up to lay on your side to like sleep like that. In my brain, I'm like, oh my gosh, like, please don't do that to my child. So I think just like little things like that, I'm not super looking forward to. Yeah, I don't know. It'll be a journey, I think, just the adjusting to new family dynamics within like, it's just been me and Alex. We've been together for almost 13 years now, where it's just been the two of us. And so, and like all of our pets, but those are
don't forget the animals.
Exactly. But like, I think adding like this new being into the mix that's going to be around for a long time is exciting, but also nerve-wracking, like how's that going to change like the dynamic between the two of us, or like just the dynamic in the household? I don't know. Like it's just a big question mark.
I mean, I always want to imagine the positives are obvious, right? Like even your story, which just like warmed my heart of like feeling this tiny little human moving inside of you as you guys came back from a camping trip, imagining, oh, like a couple of years from now, this baby will be a toddler toddling around like at this campsite with us, right?
Yeah.
But there's also truths about like the changing of dynamics like between the couple. I think a lot about like dynamics with family. Ooh and I are both very like as individuals, very stubborn, which I think I guess works out in that within our families, we're also the ones in our families where both of our parents know like, oh, we can't tell them what to do. And so I think that we assume, yeah. So I think we assume that again, if and when we start a family, I think that we assume that they're all just going to stand back and be like, okay, yeah, like just do your own thing. Because we've come out like guns a-blazing from day one. But it is true though, like you know, part of family dynamics, like for me, for example, my family is traditionally like Nigerian and very Christian. Ooh is Turkish and traditionally, culturally Muslim. It's part of the dynamics. So like, oh, at some point my mom's probably going to ask about like baptism and like, okay, how do I approach that? Right. So families merging as a unit with once children become involved becomes very complicated. It changes for sure.
Exactly. Yeah, I'm hoping that it goes well, but you just don't know. I guess it's like we're just a bunch of wild cards all like thrown into this situation.
Yeah,
we just have to figure out how to get through it. Yeah, and enjoy it.
Yeah, I think you have a really healthy approach to just like let's be flexible, let's go with the flow as much as possible, and just know, just know that what will be. Que sera, sera, as they say.
We'll see if I can put my money where my mouth is with that one.
I know you're gonna be a return guest. I'm telling you, girl, I'm bringing you back. 6 months postpartum. We're gonna reflect on all. We're gonna reflect all this. This is really funny. I don't know if you've seen this, but Billie Eilish, I think it was for which famous magazines like Vogue or something. They basically started interviewing Billie Eilish since she was like 16, and they would basically ask her the same questions. And they've now asked her that every year since. And so like she watches her like last year's answers and then answers it now where she is.
Totally.
You are my Billie Eilish, Kassie Donnels.
I'm flattered.
You really should be. She's pretty phenomenal. And we're going to come and bring you back kid after kid, year after year. No.
Yeah, perfect.
I've loved chatting with you. I mean, like you said, this is literally what you and I do on call together anyway. So it's even more fun doing it in this venue and really hoping that, you know, the wealth of knowledge that you have gets shared with a wider audience. I know our patients who have the honor of being cared with you in our clinic already and in our hospital are so lucky. So I'm hoping that even more people out there get the Kassie magic that we all get to enjoy.
Yes. Well, thank you for having me. It's been a pleasure.
Oh yeah. Any like last advice you'd give for any either currently pregnant or currently postpartum moms as they think about postpartum, about breastfeeding in particular, any final sage words to share? I
think have grace with yourself. That's been kind of the theme of this podcast. Have grace with yourself and try to have flexibility. And you being concerned means you're a great mom already or a great parent already. Just keep reminding yourself of that. I'll try to do the same.
Yes. And remind yourself too. I'll remind you because we had this conversation now. So I'm going to just keep checking in and be like, I'll just text you, be like, you're giving yourself grace, Kassie. You're giving yourself grace. I'll make sure.
It's our new motto.
I'll make sure. Yes, that's the motto. Well, Kassie, I truly, truly appreciate you. I love our time together in and outside of work and just grateful for you today.
Oh, grateful for you too. Thanks for having me.
Thank you very much for listening to The Golden Hour, the podcast community where moms and moms-to-be can hear stories from other mothers and learn from top experts in pregnancy and postpartum care. If you enjoyed this episode, please take a moment to like, subscribe, and share with your friends so we can reach more people like you. You can visit goldenhour.fm for more information, resources, and all other episodes. If you have any requests, questions, or suggestions for future episodes, please email me at hello@goldenhour.fm or leave us a comment at goldenhour.fm on Instagram. Looking forward to seeing you in the next episode. Until then, stay golden.